Hi, my name is Craig Siverhus. I'm a general and vascular surgeon who focuses in bariatric surgery. As a kid, I always wanted to be a doctor. My father's a physician. He's an OB/GYN. And when I was in middle school, they had take your son or daughter to work day. And he brought me to the operating room, so I was able to see him operate and several other operations that day, which was very exciting. I scrubbed in with a family friend of ours who was a cardiothoracic surgeon, and pretty much after that time I was convinced that I wanted to be a surgeon. Well, interestingly, when I started in practice, I didn't do bariatric surgery. At that time, there were very few operations done. They didn't have programs set up to allow people to succeed after having these operations. But over time, as I read up more about the operations and the success that people were having with these procedures, I really felt that it was something we had to offer for our patients. So I started pursuing it then and have been very satisfied with it. Well, I think it's important to develop trust with the patients between them and their physician. I think that these are operations that work in conjunction with lifestyle changes to allow them to be successful with these procedures. We do the 6-month physician-supervised diet prior to surgery, so that allows us to get to know patients better and helps them achieve those goals. It's important for the patients to be able to feel that they can trust us and that they can talk to us about the struggles that they're having as far as lifestyle changes are concerned prior to surgery. I mean, these are behaviors that they've been ingrained in for years or decades. So these are not easy changes to make. And so it's important that they can talk to us, that they can talk to the nursing staff, they can talk to the dietitian. I think that really helps them along the way. Well, the thing that I found so impressive with these operations is that they're very empowering, and people are able to take control of the healthcare issues that they have in their life, and to see them go through this whole process and resolve their diabetes, resolve their sleep apnea. It's really one of the most satisfying parts of my practice that I have. Well, we have 4 sons, and so we like to do a lot of outdoor activities, skiing, fishing, scuba diving. One of the trips that I've always enjoyed over the years, when the kids were younger, we would go to a remote lake in Canada with no television, no phones, and just allowed us to interact with them without a lot of distractions, so that was wonderful.